Hi, this is Rahul Pandit from Houston, Texas, once again at the virtual American Academy of Ophthalmology 2020 meeting. I have the distinct pleasure of welcoming Dr. Daniel Chang from Bakersville, California, to discuss his poster presentation on violet light filtration of intraocular lenses. Dr. Chang, thank you for being here.
Thanks for having me, Rahul. This is fantastic. It's a little different from the usual academy, but hopefully a lot of good information is being spread. I've had the pleasure of presenting a poster at the meeting here on violet light filtering IOLs, both visual and non-visual benefits. You know, chromophores and IOLs is not a new thing. However, I think traditionally we think about it as a kind of yes or no, like a clear or colorless versus a yellow lens. And the goal of this poster is to try to make it a little bit more detailed than just kind of a simplified discussion and understanding of it. Similarly, there's discussion of blue light filtering versus violet light filtering, which is also an oversimplification. So what we did in this study was a two-part study. One was a theoretical study looking at some theoretical values of how color filtration affects vision, and also how it affects other things in the eye, in our life, for example, circadian rhythm. And also, it was a clinical study that looked at the benefits of violet light filtration specifically. So when we think about chromophores and light filtration, I like to think about three different categories. One is visual benefits. Specifically, within that, there's things like scotopic vision. There's things like night vision symptoms, and how that can certainly affect our kind of visual effect. Then there's the non-visual effects. One is reaction oxygen species formation prevention, which could cause macular damage, etc. And also circadian rhythm, or specifically melanopsin function. So the blue light in the eye can kind of entrain our circadian rhythm. So we have non-visual benefits and also visual benefits. So some things you do want to filter, some you don't. So basically what we did is we took the action spectrum of these particular quantities and then multiplied it by the transmission spectrum of the chromophore, and then also looked at the typical kind of absorption spectrum of light that we encounter and see how much effect a violet light filter, specifically the one OptaBlue or the violet light filter that Johnson & Johnson is starting to put in some of the products. It's been around in Europe, in Japan, and also in Europe, and they're going to introduce it in the United States, and looking at how it affects these different features. We compared it with a common Acrosoft natural chromophore and just kind of show the difference. And basically looking at specifically from a visual scotopic vision standpoint, we showed that the violet light filter had less of an effect because we do need that blue light at nighttime. For reactive oxygen species formation, it was similar protection, if not a little bit more, with the violet light filter and retention of the melanopsin function. And then looking at from a clinical study standpoint, just looking at patients who had difficulty driving at night. So it was basically colorless versus the violet light filter showed there was actually a significant increase from about 44% to 53% of patients who had no difficulty driving at night. And similarly with frustration with vision, it went from about 80% to about 90% from a colorless to a violet light filtering lens. So even clinically, these were done with monofocal lenses. Patients noticed improvement in their visual comfort or just general ability to function, with the violet light chromophore. So it's interesting. It was kind of a fun study to look at a combination of benchtop theoretical data and clinical data. So we know there's a difference with different chromophore situations. But I think as we have more discussions and look more into it, is to understand that we can't just say clear or colorless versus yellow versus violet versus blues. You have to look at the entire spectrum and how the transmission, whether it's a broad spectrum versus a narrow, and what wavelengths are, and to determine what would be best for our patient's eyes.
Well, it certainly sounds like this middle ground chromophore may provide several clinical advantages to what we currently have. It'll be exciting to get lenses with this chromophore in the U.S. market. Can you also explain why it would have a positive impact on visual perceptions and dysphotopsias in people compared to other filtrations like the clear lens?
Right. We didn't specifically look in this poster at the light scatter, but we do know from a light scatter standpoint, the shorter or higher energy wavelength tends to scatter more. And some reasons, if you look into it, that's why the sky is blue. And when it comes to nighttime scatter, a large percentage of it comes from the violet light as well. So as we filter that, there's a reduction in the effect of, let's say, from the HID headlights or even from like computer screens or iPhones. Some of the shorter wavelength causes more of those symptoms. So we're expecting, we haven't looked at this clinically, but we're expecting an improvement in some of those symptoms as well.
Well, that's interesting. It sounds like the lens technologies are getting better at combating all the glare, potentially from the oncoming LED lights as the lights on cars advances nowadays.
Right. So looking forward to seeing how that functions. And there's been the introduction initially is going to be in the presbyopia correcting lens, the Technis Synergy lens, as launched in Europe and in parts of Asia, and in South America has the chromophore. We know in Japan they've had the chromophore in their Symphony lenses since introduction, and the overall complaints of night vision symptoms is significantly less in other parts of the world. So we think again, hasn't been a direct comparison yet, but there is some emerging data that suggests that it will make a big difference for us at nighttime.
Well, wonderful. Well, thanks once again for taking the time, Daniel, and being here and sharing your thoughts on violet filtration chromophores for new intraocular lenses.
Great. Thanks for having me.